People say I'm a pretty good doctor, perhaps even a somewhat better than average hospital CEO. But politics? Now, I don't want to sound like I'm complaining, but 2016 got off to a pretty rough start. Happy New Year now has a whole new meaning for me. When I said I'm proud to be the CEO of the Ottawa Hospital at this really exciting moment in our history, and when I said we've begun working with our community to create one of the finest 21st century healthcare facilities in all of Canada, I thought that would have been seen as a good thing. So first I want to start with an apology for allowing the issue of where we build our great new hospital to overshadow the far more important question of how a new hospital will transform people's lives. I am very sensitive to the concerns that have been raised by our community about a new hospital on the Central Experimental Farm. And we are working closely with the City of Ottawa and the federal government to address these concerns. And I deeply regret that the issue of where has almost overpowered our vision of what we can achieve together. Let me try to sketch an outline of this vision. Our footprint, really our face to the community, will be a building respectful of and in sync with its community and its physical environment. It's a campus that is part of a neighborhood, not bricks and mortar, glass and steel, standing in isolation. It is a built environment that respects human scale. A hospital surrounded by walking and cycling paths, gardens, and quiet places for reflection. A healthcare center that meets the highest environmental standards. A hospital that offers more and does it more efficiently. In sum, this is our goal. Buildings full of natural light, committed staff, and comfortable patients in a safer place that speeds healing and recovery. Let me take you on a visit in only a few years from now to our new Ottawa Hospital. We scan our health cards at the front door. All of our health information and records appear. When we leave, it will record our medications, our appointments, and offer us personalized health support. Our partners in your health, your family doctors, community-based clinics, home care facilities, Algonquin College, will have access to the same real-time digital updates. No more rushing x-rays and test results from one distant health professional to another. And for the first time, you, as a patient, as a family member, or as a caregiver, will have access to the same updated health records from anywhere in the world. Isolation rooms, floor layouts, and monitoring systems will be designed to defeat those superbugs. New materials will help repel viruses and drug-resistant bacteria. Technology designed for regular updates will be at the center of our operating theaters. Diagnosis and surgery will be done in tandem in the same OR suite. You, your parents, perhaps your children, will no longer need to be moved from floor to floor. We will save precious time for patients suffering from strokes, heart attacks, and major trauma. Every minute saved means a difference between a happy outcome and permanent disability or even death. Today, we have a committed, caring staff, researchers and clinicians who collaborate to ensure that our patients receive the most up-to-date, advanced care available. But they do it in a facility that was first opened nearly a century ago.